Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop fatigue. This is a very special topic to me because I used to suffer from chronic fatigue after my second cancer treatment. And unfortunately, during that time, the healthcare providers that I work with has two answers for me. The first answer is my lab looks normal, so there's nothing wrong with me. The other answer that I am a hopeless case. And that's what led me to study nutrition, reading a lot of books, really going through studies and actually evaluate my own lab and figuring out how to avoid or having normal energy throughout the day naturally. So a lot of the steps that I'm gonna go over with you, I personally experienced those and those deficiency, and I was able to overcome my own fatigue, and I actually see similar result with my patient when they implement those approaches. So in this video, I will go over how to stop fatigue, and I will go over 6 reasons or causes that cause fatigue, and majority of those causes actually overlooked by a lot of healthcare providers. That's why a lot of patients do not have energy and they don't get back to normal. So make sure you watch this video to the end because it's gonna make sense when we go over the treatment plan, how you can address it even at home to really have a good energy level. Okay, so we're gonna start with describing what is fatigue, the 6 causes, and then the treatment to increase the energy level. So first, fatigue, it's usually decreased muscle ability to perform over a period of time. So you're really doing, like I will give you example. After my cancer treatment, it used to take me 5 to 10 minutes to go from the living room to the bathroom. It was actually very tiring, very painful actually to really just have to walk 15-20 feet. So that is decreased muscle ability to perform properly, weak muscle and tiredness. Okay, so what are the causes? Well, one of the very common cause that actually overlooked significantly, and I personally had this issue, is the thyroid hormones and the adrenal gland hormones. A lot of healthcare provider, they check the TSH and they don't check the T4 and T3 and a relation between this and minerals, and that's a very common source of fatigue. The other issue is adrenal hormones like the pregnenolone, the DHEA, the testosterone, estrogen, progesterone. Unfortunately, pregnenolone and DHEA, that's one of the tests that ignored by a lot of healthcare providers, and that's very common to have issue with those hormones, especially if you have fatigue. So first reason is hormonal imbalance. So we need to really figure out which hormone that might have deficiency with to address it properly. The second reason is vitamin deficiency. So these are the list of the vitamins that's related to energy and tiredness, and these are a common deficiency with a lot of patients. B vitamins, there's 8 B vitamins, we have to evaluate all of them. Vitamin C, D, K2, and I personally had B deficiency, D deficiency, and the healthcare provider, no one did a blood work during that time for the B and the D, unfortunately, and I had to do it on my own to really figure out the deficiency and be able to work on meeting those deficiency. The third reason is mineral deficiency. So it's not a common routine of blood work to check for the magnesium or iodine or selenium or zinc. That's why several of the healthcare providers that I work with after my cancer treatment told me my lab looks normal. because that's not a common routine lab test. They looked at the CMP or CPC, CBC, and that's not including the magnesium, the iodine, the selenium, and zinc, and those has good relation to muscle fatigue and low energy. And I have a video on each one of these minerals to really understand the significant effect on the body. So the third reason is mineral deficiency. The fourth reason is your diet. That's one of the things you can do actually today. Avoid refined carb, refined sugar, alcohol, artificial sweetener, and processed food. There's not a lot of nutrition value from here. And actually, you eat this food, you're gonna cause more deficiency in those minerals. You're gonna cause more deficiency in those vitamins because that refined carb, refined sugar, and processed food does not have a lot of nutrients. So it's actually gonna cause more deficiency in this. So that's what you can do today. Start by cutting refined carb, refined sugar, like candy, cake, any sweets, bread. And I have other video going in different aspect of the diet. Make sure you subscribe to the channel to watch those videos and get notification for future videos about these topics. So the fifth reason that actually overlooked by a lot of healthcare providers, that certain medication may cause fatigue. And you can read this list. I highlighted the ones that actually very common. There's a lot of people taking those medication, but they don't realize long term of taking those medication will cause fatigue. And actually, several of those drugs are gonna cause more deficiency in vitamins and minerals and make the symptoms worse, or actually that could be one of the trigger for fatigue. So alcohol is main one. Cholesterol medication is statin. It's actually, there's a disease called statin is induced myalgia, which actually muscle fatigue. It is caused by over a long-term use of statin drugs. So that could cause fatigue. Opioids, I personally used to take that after my cancer treatment, and were like, oh, you have fatigue. I'm like, that could be side effect of the drugs. Diabetic medication, blood pressure medication, a lot of these stuff in the list, it actually taking it for prolonged time cause fatigue. So if you take some of these drugs plus your diet is does not have a lot of nutrition, and you add to that vitamins and mineral deficiency and hormonal imbalance, that's a very good recipe to have chronic fatigue, and no one will figure it out if they do not address or evaluate all of these elements simultaneously. Because reality is, it's never vitamins deficiency only. It's never mineral deficiency only. It's never hormonal imbalance only. And I will give you example on myself. So after my cancer treatment, I had thyroidectomy, so there is no thyroid hormone, so I have to work on that. But there's other nutrition and vitamins, mineral, I had to take it at the same time. So the healthcare provider did not look at this, so I personally had to do that. The other thing, I had pregnenolone and DHE deficiency and testosterone, so I had to evaluate that and really address it simultaneously. But to add to the problem is, I had B deficiency, D deficiency, and I had magnesium, iodine, zinc deficiency. So, and my diet was not really the best diet, and I was taking some of these drugs. So that is extreme recipe for disaster. So a lot of patients probably will have a combination of those five, or most of those fives, that in their life that actually cause the fatigue. So the last one is toxicity. So if you have mercury, that's usually in the amalgam, the silver filling, that could cause neurotoxicity and cause fatigue. If you're exposed to lead or mold, that will lead to fatigue. So to really get to the root cause of the problem, we need to figure out which causes actually is applicable to you, because there is no one size fits all. If someone say like it's all B vitamins, that is incorrect state. So the reality is it's never one of those 6 reasons. It's typically a combination of those reasons. You probably will notice that if your diet has this element, that will cause issues. And if you have any vitamins, mineral deficiency, hormonal imbalance, that make it more complicated of having those experience of fatigue. So what should we do at home as a treatment to figure out the fatigue and to get more energy? First thing you can do at home, cut refined carb, refined sugar, alcohol, artificial sweetener, and processed food. Start to have fresh fruit and vegetables and healthy fat. The second thing, we need to evaluate which element of those, either hormone, either like vitamins, mineral deficiency, which elements that you have deficiency with. As I mentioned to you, based on my personal experience and the patient I see, it's never one vitamin or one mineral or one hormone. It's very common with chronic fatigue patient to have several deficiency, vitamins, minerals, hormonal imbalance. Sometimes they have toxicity. So we really need to evaluate the root cause of the problem. One of the way you can do right now actually is taking advantage of Ask ASTR. It's a free online medical evaluation. It takes about 5 minutes. The software has a database of at least 9 healthcare providers. So the software will ask you a question to guide you through the process of discovering possible vitamins, mineral, or hormonal imbalance. And it's just very easy to use. Take advantage of that. The other thing, if you want a personal care and you want me to do evaluation with you, click the link below, contact my office to schedule either telehealth or personal visit to figure out why you have those chronic fatigue. So if you have any question or comment, leave it in the comment section below and I will answer it in the future video. I will see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.